If you've already tried an antidepressant and hit a wall, sexual side effects, emotional flattening, or only partial relief, the next step isn't always obvious. That's usually where Viibryd enters the conversation. Not as a miracle drug, but as one of a few second-line options people weigh against alternatives like vortioxetine, Trintellix, or bupropion, Wellbutrin. The problem is that Viibryd behaves differently than most antidepressants. And misunderstanding that is why many people quit early or never get to the benefit. In this video, I'm going to show you where Viibryd actually fits, who tends to do well, who struggles, and what you need to get right early if you're going to try it at all. And who am I to help you decide whether Viibryd is actually a smart next step or an expectation mismatch you can skip entirely? My name is Dr. Sulman Aziz Mirza, triple board certified adult psychiatry, child and adolescent psychiatry, and addiction medicine. And I spend a lot of time helping people who came to see me after a first antidepressant didn't do the job. Let's set expectations clearly, because this is where Viibryd either makes sense or doesn't. Viibryd, also called Vilazodone, isn't just another basic SSRI antidepressant. It does block serotonin reuptake, but it also partially stimulates a key serotonin receptor called 5-HT1A, the same receptor family targeted by bupropion or Buspar. That second action is why I think of it as an SSRI adjacent rather than a standard SSRI. Well, why does this matter in real life? Because the 5-HT1A receptor plays an important role in anxiety regulation and emotional tone. For some patients, that means antidepressant coverage without quite as much emotional numbing. For others, it means a slightly activating feel early on. And this is the part people miss. That receptor effect isn't a bonus feature. It actively shapes the day-to-day experiences of the medication, especially in the first couple of weeks. Compared to traditional SSRIs like fluoxetine or sertraline, Vilazodone doesn't just raise serotonin levels, it also talks back to the system that regulates serotonin signaling. That's where the claims come from of less emotional blunting and potentially fewer sexual side effects. On core depression outcomes, Viibryd is an effective antidepressant, but it isn't consistently superior to standard SSRIs. So this isn't a drug you choose because it's stronger, you choose it because the profile might suit you better. Early on, expect variability. In the first couple weeks, some people feel mildly jittery or wired, others feel a bit calmer. That range is normal, and if you know it's coming, you're much less likely to panic quit on day 3. But before we talk about sexual side effects, the question everyone wants answered, you need to understand the trade-off that ends more trials than anything else: your gut. Nausea, diarrhea, and stomach upset are common early on, and they're the number one reason people abandon Vilazodone in the first couple of weeks. But what's rarely explained is that these side effects are highly sensitive to how the medication is taken. Viibryd needs a real meal, not a cup of coffee, not a Ritz cracker, actual food. When taken with a proper meal, blood levels rise into a stable therapeutic range. When taken without food, absorption drops and becomes inconsistent, which can mean less benefit, more GI upset, and a very uneven day-to-day experience. This isn't just me telling you to eat more, it's pharmacokinetics. The fix is boring but powerful. Pair the medication with your most reliable meal of the day. If you always eat breakfast, take it right after breakfast. If dinner is your go-to meal, take it then. Choose the meal you almost never skip. Practical details matter. Include some protein and some fats. Drink water. If nausea is an issue, many people do better taking it with dinner so they can sleep through early queasiness. Viibryd used to come in a starting kit of 10 mg daily for 1 week, then increasing to 20 mg daily. Some people can go up to 40 mg if needed and tolerated. The slow ramp isn't arbitrary. It reduces the GI upset and lowers the risk of misreading early activation as this medication makes me anxious. Here's the pattern I see in people who struggle: sensitive stomach, irregular meals, inconsistent timing, and frustration that the medication never settled. That's not a failure, it's a fit issue. Clear this hurdle and you've earned the right to ask the question everyone cares about. Does it actually spare your sex drive? Let's address this without Big Pharma in my ear. The idea that Viibryd is easier on sex comes from its mechanism. The 5-HT1A partial agonism can counter some serotonin-driven sexual dampening, at least in theory. Early studies also suggested it might carry a lower sexual burden than some SSRIs, especially compared with drugs like paroxetine, Paxil. Here's the reality check. Lower risk is not zero risk. People can still see changes in desire, arousal, or orgasm. And dose matters, and timing matters, and individual biology matters more than any mechanism on paper. So the promise isn't preserved sexual function, it's potentially fewer sexual side effects than certain SSRIs. That distinction matters because misunderstanding is where disappointment starts. Now, zoom out to the emotional and anxiety profile. Partial agonism isn't sedation, it's regulation. Some people report less emotional flattening and a bit more range. Others feel early activation, restlessness, jitteriness, or sleep disruption, especially in the first couple weeks. That early activation is often misread. It doesn't necessarily mean worsening anxiety long term. In many cases, it settles as the nervous system adjusts, particularly with gradual dosing and consistent use with food. Here's the pattern I see in people who benefit. They responded to an SSRI, but hated the emotional numbing or the sexual side effects. On Vilazodone, they often report more emotional texture and fewer sexual problems. Not none, but fewer. Which brings us to the real decision point. How does Viibryd compare to the other options people usually consider next? This is where most people are actually stuck, choosing between alternatives after an SSRI didn't give them what they wanted. The cleanest way to think about this is trade-offs, not winners. Let's start with bupropion or Wellbutrin. This is usually the go-to when energy, libido, focus, or weight are the main concerns. It's activating, often neutral or positive for sex, and can feel mentally clarifying. The downside? It can sharpen anxiety, irritability, or insomnia, especially if you're already wired or sensitive to stimulation. Now, vortioxetine or Trintellix. This is the serotonin option with the strongest data for sexual tolerability and cognitive benefits. It's often easier on sex than standard SSRIs and tends to feel emotionally cleaner for many people. The trade-off is potentially significant nausea early on and, for some, a subtler antidepressant feel. It's a good fit if you want to stay serotonergic but reduce side effects. So, where does Viibryd fit? Think of it as SSRI adjacent. It keeps serotonergic coverage but adds receptor modulation that, for some people, means less emotional flattening and potentially fewer sexual side effects than traditional SSRIs. The cost is the GI sensitivity and the strict food rule. If you can't reliably take it with meals, this is usually a deal breaker. So here's the pattern I see most often. If libido and energy are the top priority, go with Wellbutrin. If sexual tolerability and cognition matter most, go Trintellix. If you want serotonin benefit with a lighter emotional sexual profile and you can respect the GI rules, go with Viibryd. None of these are perfect. They're preference matches. The mistake is treating them as interchangeable. The win is choosing based on what you're trying to fix and what you're willing to tolerate. At this point, you're at a fork in the road. One path is trying Viibryd, but only with the right expectations. The other is choosing a different next step entirely. To decide which path makes sense, ask yourself a few simple questions. Did I respond to an SSRI, but hate the emotional or the sexual trade-offs? Can I reliably take a medication with a real meal every day? And am I willing to give it 6 to 8 weeks before judging it? If those answers are mostly yes, Viibryd is a reasonable next step. If not, it's probably a mismatch. And that's useful information, not failure. And if the real decision you're weighing is Viibryd versus vortioxetine or Trintellix, the next video down below breaks down Trintellix in depth, how it works, who it fits, and how it compares head to head, so you can choose the path that actually fits. Until next time, be safe and be well.